Assalamualaikum warahmatullahi wabarakatuh. Hello ladies and gentlemen. Let me introduce myself. My name is Afia Safitri. You can call me Afia. I'm from the first semester of Diplomatry in Blood Bank Technology, Health Polytechnic of the Ministry of Health Semarang. Here I will present my work on the topic of leukemia. There are several points that we will discuss leukemia. How does a person get a leukemia? What is leukemia? Types of leukemia and types of treatment include. Leukemia develops when the DNA of developing blood cells, mainly white cells, incurs damage. This causes the blood cells to grow and divide uncontrollably. Healthy blood cells die and new cells replace them. These develop in the bone marrow. The abnormal blood cells do not die at a natural point in their life cycle. Instead, they build up and occupy more space. As the bone marrow produces more cancer cells, they begin to overcrowd the blood, preventing the healthy white blood cells from growing and functioning normally. Eventually, the cancerous cells outnumber healthy cells in the blood. Leukemia is a cancer of the blood or bone marrow. Bone marrow produces blood cells. Leukemia can develop due to a problem with blood cell production. It usually affects the leukocyte or white blood cell. Leukemia is most likely to affect people over the age of 55 years, but it is also the most common cancer in those aged under 15 years. Acute leukemia develops quickly and worsens rapidly, but chronic leukemia gets worse over time. There are several different types of leukemia, and the best course of treatment and a person's chance of survival depends on which type they have. Types of leukemia. There are four main categories of leukemia: chronic and acute leukemias. During its lifespan, a white blood cell goes through several stages. In acute leukemia, developing cells multiply quickly and collect in the marrow and blood. They exit the bone marrow too early and are not functional. Chronic leukemia progresses more slowly. It allows for the production of more mature, useful cells. Acute leukemia overcrowds the healthy blood cells more quickly than chronic leukemia. Lymphocytic and mucinous leukemias. Doctors classify leukemia according to the type of blood cells they affect. Lymphocytic leukemia occurs if cancerous changes affect the type of bone marrow that makes lymphocyte. A lymphocyte is a white blood cell that plays a role in the immune system. Myelogenous leukemia happens when the changes affect bone marrow cells that produce blood cells rather than the blood cells themselves. Acute and lymphocytic leukemia. Children under 5 years old are at the highest risk of developing acute lymphoblastic leukemia. However, it can also affect adults, typically of over than the age of 50 years. Out of every 5 deaths of ALL, 4 occur in adults. Chronic lymphocytic leukemia. This is most common among adults over 55 years, but younger adults can also develop it. It is more common in men than in women and rarely affects children. Acute myelogenous leukemia. Acute myelogenous leukemia is more common in adults than in children, but overall it is a rare cancer. It develops more often in men than in women, develops quickly, and symptoms include fever, difficulty breathing, and pain in the joints. Environmental factors and can trigger this type. Chronic myeloid leukemia. Chronic myelogenous leukemia mostly develops in adults. Children rarely develop this type of leukemia. Type of treatment include watchful waiting. The doctor may not actively treat slower growing leukemias, such as chronic lymphocyte leukemia. Chemotherapy. A doctor administers medicines intravenously, using either a drip or a needle. They target and kill cancer cells. However, they can also damage non-cancerous cells and cause severe side effects, including hair loss, weight loss, and nausea. Targeted therapy. This type of treatment uses tyrosine kinase inhibitors that target cancer cells without affecting other cells, reducing the risk of side effects. Examples include imatinib, dasatinib, and nilotinib. Many people with CML have a gain mutation that responds to imatinib. One study found that people who received treatment with imatinib had a 5-year survival rate of around 90%. Interferon therapy. This slowly and eventually stop the development and spread of leukemias cells. This drug acts in a similar way to substance that the immune system naturally produces. However, it can cause severe side effects. Radiotherapy in people with certain types of leukemia such as ALL. Doctors recommend radiation therapy to destroy bone marrow tissue before a transplant. Surgery. Surgery often involves removing the spleen, but this depends on the type of leukemia a person has. Stem cell transplantation. In this procedure, a cancer care team destroys the existing bone marrow with chemotherapy, radiation therapy, or both. Then they infuse new stem cells into the bone marrow to create non-cancerous blood cells. This process can be effective in treating CML. Younger people with leukemia are more likely to undergo a successful transplant than older adults. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.